This is SSN.
Story Studio Network.
I'm Tom Hoppe, and I'm your host of the Most Painful Podcast. Before I start the show today, I just want to say thank you to our listening audience. Our show has grown. We're being heard both in Canada, the US, Europe, and other places in the world. And that's all due to your feedback to help us make this show better. I also want to highlight some of the programs that are coming on for the remaining of Season 2, which will end in May 2023. We're going to talk about safe movement. We know with chronic pain, safe movement is important, but how do we do it right? We're going to have Dr. Lindsay Wright on to talk about that. And also nutrition and pain. We know that food fuels the body, what food is good for pain, and what food causes pain. So we'll have those shows on. And also coming up, we're launching the French version of the Most Painful Podcast. And to finish off Season 2, I'm going to have the host of the French version of the Most Painful Podcast, Luc Hibert, on the show to talk about the show itself and when it's going to start. Once again, I'd like to thank everybody for making this show possible and listening to the show and providing your feedback. We're going to have Season 3 starting in the fall of 2023. So please send us your suggested topics, because we want to provide evidence-based information to help you, veterans, clinicians, researchers, anybody struggling with pain. So send your suggestions in. You can contact us on Facebook and Twitter at Chronic Pain COE and on Instagram at Chronic Pain_COE. Thanks for your support, and now we'll carry on with the show. On past podcasts, we've talked to many experts on different pain treatments that are available for people suffering from chronic pain, such as cannabis and psychedelics. But what about yogic breathing? Can it help someone who is suffering from pain? Today on the show, we are joined by Dr. Abhimanyu Sud, who is the Chief Scientific Officer for the Chronic Pain Center of Excellence for Veterans, a family doctor, and is involved in research on yogic breathing. Dr. Abhimanyu Sud, welcome to the show.
Wonderful to be back, Tom. Thanks for having me.
Yes, thanks for coming back. I need to learn about this. So maybe you can start me off by explaining what is yogic breathing and what's the goal of the research project that you're involved in?
Yeah, I think it's helpful to take a step back and think about our day-to-day lives and why breathing and breathing in particular ways may be important, if not actually vital for that. I mean, no matter what we are doing, eating, sleeping, walking, talking, we're breathing. Our breath is there with us at every moment of our life. If it's not there with us, then we don't have a life.
Yeah.
That's really the it sounds trite, but that is the fundamental basic starting point, starting insight, is how important the breath is to every moment of our lives. Tom, let me ask you, you've had a tough day and you come home, you sit on the couch, you finally get to relax. What do?
Probably eat some bonbons and watch soaps. No. Yeah.
Yeah. How do you breathe? What's the first thing you do when you sit on that couch?
I think some people have a sigh, or it could be fast breathing. And I think you're probably heading towards the word awareness. No?
I'm not. No. I mean, this is what I do. If I had a long day, come down, sit on the couch, and big sigh of relief. Okay, it's done now. I can kind of move on, right?
Yeah.
If we're angry, how do we breathe? It's pretty typical across cultures, across people, right? Hard, heavy breaths, right? We breathe like a bull.
Yeah.
Right. That's the expression.
Fight or flight comes in.
Yeah. And when we're happy, we breathe in certain ways. When we're sad, we breathe in certain ways. And so the state of our mind is intimately linked to our pattern of breath. And the quality of our life is determined by the state of our mind. Right? We could be in the most beautiful place, with our nearest and dearest, but if we're angry, upset, stressed, we're not going to enjoy that moment. So the quality of our life is determined by the state of our mind, and the state of our mind is intimately linked to our pattern of breathing. And so the fundamental insight of yogic breathing is that, and that in fact, if we can turn that relationship around by breathing in certain ways and in certain patterns, we can affect a change at the level of our mind. And why would we want to do that? Because our mind is very difficult to control using our mind. It's very hard. You may be angry and you may tell yourself, Abhi, stop being angry. But it doesn't work. It doesn't work. It's very difficult. It's very, very difficult. But by using our breath, we can affect a change at the level of our mind and then impact the quality of our life. And this is true for, people living with pain, people living without pain, veterans, non-veterans. But this basic insight that doing something very simple, it was described to me when I first got exposed to yogic breathing, that it's like the breath is like, I used to like to fly kites when I was a kid. I remember when I was about 10 or 11, I had a close friend who got into, I don't know if you've flown kites before, but there are these box kites.
Oh, yeah. Yeah.
That go up, like 1,000 feet. And it was wondrous. I loved it. And it was first just so it really stuck with me when I heard it, that the breath is like the thread. Our mind is like the kite, just kind of getting blown around by the circumstances around us. If it's windy, it's going to go, if they're westerlies, if they're easterlies, it's going to go in a certain direction. And it's very difficult for us to control it. But the breath is like that, is like the thread, right, that we have control over, because we can actually change how we breathe. We can't change our mind directly, but we can change how we breathe. So it gives us that access. The breath gives us that access to the mind, which is like just a little bit too subtle. It's like trying to grab water with our hand, right? You can't quite do it, but if you have a cup or you have a bowl, right, then you can sort of capture that water. And I think that's what the breath lets us do. So these insights are, possibly as old as humanity, who knows? But within the practice of yoga. And, when people think about yoga, obviously the first image that comes to mind is doing the yoga asanas, the physical exercises. And in fact, that's a very, very small, almost insignificant part of yoga. Yoga is not about the flexibility of the body at all. Yoga is about flexibility of the mind. Now, obviously, the mind and the body are connected, and by doing, yoga asanas or yoga exercises, we can stimulate a change in our mind for sure. But the focus of yoga is actually flexibility of the mind.
So it's similar to, I guess, mindful movement then. We had our last guest, Dr. Gupta, was on a few weeks ago talking about mindfulness. So what I hear you, it's almost like mindful movement, where I want to, be aware, I guess you're saying, of breathing, but then also just slowing down and controlling my breathing, but using movement to kind of calm myself or center myself. Is that what I'm hearing?
Movement can be one way to do it, but movement is not essential to practicing yogic breathing practices. So yeah, actually, when we look at yoga, there are sort of multiple interconnected, what are called sort of limbs of yoga, of which, asanas or sort of movement exercises are one, and pranayama or breathing exercises are another, and they're connected to each other. And it's a little bit more, absolutely. I mean, I think ultimately the end goal is awareness in the moment, but that's can be difficult to cultivate, and it takes time to cultivate. And it can be challenging also, particularly for people who are under a lot of stress, potentially who have a history of trauma, or particularly who have a history of pain as well. It can be difficult to stay in the present moment. It can be very challenging to do that. And so you need something. Often we need something. It can be helpful to have something that can get us there, rather than kind of, sort of forcing our mind to try and get there or do that. And it should be natural, right? I mean, if we are, the rule, and this is often, I think, where we get tripped up sometimes, and the difference is that, the rule at the level of our body is one of effort, right? If we put in effort, we will get results, right? If we lift weights every day for 3 months, we will get stronger. The more effort we put in, for the most part, the better results we're going to get. But the mind is tricky, and the rule of the mind really is effortlessness. How do we exist, be present, be aware effortlessly? That's the rule of the mind. Because the rules of the body don't apply to the mind. The more effort we put, if I told you, actually this is a a real concern for a lot of people. Let's think about falling asleep. If you try very hard to fall asleep, are you going to fall asleep?
Depends how tired I am, I guess.
But at some point, to fall asleep, we have to let go. If we are putting effort, by definition, we're not sleeping. So it's something that we all have. We all have the ability to be effortless and to let go. But learning to cultivate that, and the breath can be extraordinarily helpful in doing that because it allows you to put in a little bit of effort, which we're used to doing, but the result of that effort is effortlessness.
So someone who's maybe saying, I got to breathe better or meditate better, and they put a lot of effort into it, actually won't go as far as someone who just practices and sees where it goes, I guess, in a sense, like just kind of.
No, so that's all I'm saying. What I'm saying is that because our mind in our lives, we're used to putting effort. Breathing practices are very helpful. Certain kinds of breathing practices are helpful because they allow us to channel that effort towards effortlessness. You can't just let go. I mean, it's very difficult. I mean, I'm sure there's some exceptional individuals out there who have the ability to just be totally effortless and natural. But that's not the norm.
Especially if you're a type A personality.
Especially if you're a type A personality. Absolutely.
Yeah. Which a lot of military people may be. As top performers could be. Yeah.
Right. I mean, and we may be trained, we trained to be that way. Right. I think physicians also are trained to be that way. Right. Organized, effortful, purposeful.
Mm-hmm.
And let me be clear. I'm not saying there's anything wrong with that. That's important. But at the same time, there's a flip side to life, which is being able to be effortless. And, so this has been, besides as a way to help people have a better quality of life overall, has been applied pretty widely in medical treatment settings. So, for example, a breathing practice called Sudarshan Kriya Yoga has been applied quite widely amongst veterans to help improve particularly symptoms of post-traumatic stress, hypervigilance, nightmares, et cetera, all the things that go together with, I'm sure listeners are familiar with the cluster of symptoms with PTS. And there have been a number of clinical trials that have demonstrated the efficacy of this breathing practice for improving post-traumatic stress disorder amongst veterans. So most recently, there was a trial out of the Palo Alto Veterans Affairs Hospital in the U.S. It was a randomized controlled trial, and in this case was what we call a non-inferiority trial. So sometimes when we're looking at if there's an established treatment out there, so first-line treatment, at least in the medical world, for post-traumatic stress for veterans is psychotherapy, certain kinds of psychotherapies, in particular cognitive processing therapy. And so sometimes when there's an established, what's considered sort of a gold standard or first-line treatment, then a trial design to study alternative treatments is something called non-inferiority trial, which is not the purpose of those kinds of trials is not to investigate whether one treatment is better than the other, but are they actually about the same? So if a new treatment can be demonstrated to be as effective as an established treatment, then that provides an opportunity to think about that treatment, putting that treatment into practice. And so some investigators, physicians and investigators at the Palo Alto VA conducted, and they just recently published just a couple months ago, the results of the study which demonstrated non-inferiority of Sudarshan Kriya Yoga compared to cognitive processing therapy. And so, reflecting on this and thinking about this, there's a huge need to be able to deliver effective therapies for Canadian veterans living with post-traumatic stress disorder. There are issues around access to care because of geographic challenges, where treatment centers are distributed, where veterans tend to live across the country. And frankly, we also know that the existing treatments, so psychotherapies, medicines, they work very well for some people, and they don't work very well for other people.
And that's it. We've heard the same with cannabis as well, right? It's some people it works and some people it doesn't.
Absolutely, yeah. I mean, the difference, I think actually, there is a difference with cannabis is that there's actually a lot more study of things like cognitive processing therapy, of different medications for the treatment of PTSD. So we know much better what we can expect from those treatments. particularly for PTSD. And we know that we should anticipate that there are going to be people who don't respond to those treatments. And so we need alternatives that are available. And also some people don't want to engage in talk-based psychotherapies regarding their traumatic histories.
So this is where the breathing comes in.
Yeah,
place.
this is where something like, amongst other kinds of interventions, breathing could be very helpful. Because besides also, it's interesting because, breathing practices, they can affect both the physical as well as the mental at the same time. Like we know these breathing practices, for example, have definite physiological effects. They change how our immune system functions. They change how our cardiovascular system functions. They have impacts on our sympathetic nervous system. So the balance between the sympathetic and parasympathetic nervous system, changes in vagal nerve tone. All these things are impacted by how we breathe, in addition to the impacts that we see in terms of mental quality of life, changes in anxiety scales, et cetera, et cetera. But they don't require that people engage. Now, usually these programs are delivered in groups, but they don't require people to necessarily talk about or analyze or share their traumatic histories. Now, some people may choose to do that, and that may be perfectly therapeutic for them, but it's not a requirement to be able to get the benefit, and that requirement can sometimes be a barrier for people to engage and access in effective therapy.
You're talking the nervous system as well, which has an impact on chronic pain, right? Because we have a connection between mental health and chronic pain from some of the research that's out there. Is that correct? That's how it could help?
Oh, absolutely. So, huge overlap between chronic pain and PTSD in the general population, more so even in the veteran population. Some clinicians, some people, some veterans describe, chronic pain and mental illness, mental health as really two sides of the same coin, right? So besides PTSD, we also know a lot of people living with chronic pain, veterans included, also can have significant symptoms of depression or anxiety. And these things, they go together very tightly. Obviously, I mean, just we think about, if our pain is really bad, it can affect our mood. When our mood is very bad, it can affect our pain or our ability to cope with our pain. But besides that, they also both, exactly, I think what you were alluding to, Tom, is that they both impact our nervous systems, right? And they can impact our nervous systems in ways that make both conditions kind of worse. And so, yeah, exactly. We need to be able to identify interventions that can be helpful for both conditions at the same time, right? Because that's what people are living with, right? People often don't live just with chronic pain or just live with post-traumatic stress. If we're talking about delivering whole person care, we want interventions, therapeutic interventions, to sort of match the needs, right, of what people are living with, that can be helpful for multiple kinds of things. I think about these things, very similar to physical exercise, right? We know physical exercise has multiple kinds of benefits: mental, physical, emotional, right? Likewise, practices like meditation, breathing practices, I think they're very appropriate because they're also very safe, right? A lot of trials have investigated these, including in populations where there's pretty severe illness, and there's not a lot of negative side effects of these kinds of interventions.
To bring it down to the breathing part now. So I fully get what you're saying is that, if we have both mental health and a physical chronic pain, and we do some breathing that helps our nervous system. So if you were to provide some guidance or tips, I'll let you decide how you want to frame that. Where does someone start?
Okay, I'll do you one better. Do you want to do a breathing practice together?
Sure, let's do that.
Okay. So this is a very simple but powerful breathing practice. It's called ujjayi breath. Ujjayi means victory. Victory of the breath over the mind is literally what this breathing practice can help with. So I'm going to demonstrate it, and then I'll walk you through how to do it. And I'm going to exaggerate a little bit so that you can hear me through the mic.
Yeah, since we don't have any visual, this is all audio. So
Yeah. I will demonstrate, and then I'll walk you through how to do it. Okay.
And that's all through your nose, from what I can see.
So you're breathing in and out through our nose. And what we're doing is we're making a small constriction at the back of our throat. We make, okay, so let's say it's a really hot day outside. You come inside, you pour yourself a glass of lemonade, nice cool lemonade, you take a sip. And what's the sound that you make? Okay, so if you make that sound, when you make that sound, you make that same constriction at the back of your throat. But we do that breathing in and out through our nose. It's also very similar to what happens when we snore.
Yeah.
When we snore, the back of our mouth gets lazy, and that's why we make the snoring sound. So we can try this together. And when we breathe, it's helpful to close our eyes, just so we keep our attention on our breath and keep our attention inside. And we'll just take some long, deep breaths using...
And just for our audience who's listening, so your eyes are closed and you're breathing in through your nose and out through your nose.
Yep, with a small constriction. And you'll hear that kind of rasping sound as you breathe in and out.
Okay.
Okay, we'll take one more deep breath.
Well, I do have to say that, focusing on the process, for me, helps focus my mind. So I'm not thinking about other things. I'm just thinking about how I'm breathing here. That's one thing. And then after a bunch of breaths, I'm ready to go have a nap. So it's kind of relaxing me. So how long would someone want to do this for? Like, what's the length that someone would want to do this for?
Yeah, I mean, ujjayi breath is very simple. Even if you sat for 4 or 5 minutes and used ujjayi breath to take some deep breaths in and out. I mean, even after the few breaths that we did together, Tom, right now I already notice a change at the level of my mind, a little bit more focus and concentration and a little bit more settled. You do that for 4 or 5 minutes and, for sure, you'll notice a difference. And like I said, that's just one example of many different kinds of practices, but it's a very simple yet powerful one.
Well, I'm sure our audience will get some benefit out of that. I know I did. So that's one more thing I'll add to my utility belt of things that I'm trying to do. So thanks so much for that, Dr. Abhimanyu Sud, and for being on the show. We could talk a lot longer because there's just so much to talk about, but maybe we'll have to have you back and do a continuation in season 2.
Oh, sure. Well, we can do a part 2. Yeah.
Yeah, part 2 for that. Well, thank you very much for being on the show.
Thanks so much for having me again, Tom.
And for our audience, if you have any feedback about the show or you want some more information on chronic pain, you can visit our website at veteranschronicpain.ca or follow us on Facebook and Twitter at Chronic Pain COE and on Instagram at chronicpain_COE. So the Chronic Pain Center of Excellence, there's lots of information on the website, both for researchers, clinicians, and veterans, and for anybody who's suffering with chronic pain. So it's a good place to go and get some information. Until next time, stay safe and keep hope alive.
The Most Painful Podcast is produced for the Chronic Pain Center of Excellence by Story Studio Network and Eye Contact Productions.